Assalamu alaikum. We'll start. I'm Dr. Omar Othman. I'm an emergency consultant at King Saud Medical City, the famous Shemesi, if you don't know King Saud Medical City. Now it's not allowed to call King Saud Medical City Shemesi. If you say Shemesi any place, anytime, you'll be jailed, okay? So don't call it Shemesi. Never. Khalas, it's King Saud Medical City. So who think of back pain as a silly complaint? Who think of back pain as a silly complaint? One only. Silly, stupid complaint. No? Most of the time. Sometimes هذه كلمة politics شوية. نبغى واحد عنيف يعني. يعني هو لما يشوف واحد عنده باك بين يقول يا اخي زعجونا هذول والله ما عاد يدري جايبهم من المستشفى. I want to show of hand. Show of hand. Silly complaint. Back pain is a silly complaint. One female, one male, 2, 3, 4. Whoa. So it's, yeah, it looks like a silly complaint, yes. You know how many of our population will have a back pain in their life? 100%. So, yeah, it reaches around 90% actually. So we have around 90% of our population will have a back pain in their life. And 90 of those 90, their back pain is really silly complaint. So 90% of our back pain is silly, but there is 10% who's having a real serious back pain. So do we need to take it seriously? That's why we are presenting this lecture, to differentiate between who should be taken seriously if he had a back pain. If you know this, you don't need to know anything about the investigation that will be done for those patients. I need you just to pick up the patient who need to be investigated, and that's all. The investigation that will be done for him is none of your business. Okay? So let's pick up those patients and then we can decide what we'll go over this. Right. Acute back pain. What's the definition? 2 weeks, 3 weeks, 6 weeks, 6 weeks. شفتوها هذه ولا هذا؟ 6 weeks. An أغرب acute complaint we ever had. 6 weeks usually is not acute in emergency. 3 days actually is not acute in emergency. So this is for back pain is special. So if you have a back pain for more than 6 weeks, less than 6 weeks, it will be an acute back pain. And chronic? More than 6 weeks? لا. 3 months. 6 months. 3 months. Okay, so more than 3 months, it will be a chronic pain. Between those, it will be a subacute. And what we are talking about today, it will be the acute back pain only. We are not talking about the chronic or the subacute. We are talking about acute only. So if the pain is less than 6 weeks, that's our patient. Okay? So we'll have some talk about the chronic, but in general, if we have a pain less than 6 weeks, it will be our patient. This is our population. Okay? So what does red flag mean? Yeah. Thought? Something serious. So no, I mean, if you have a red flag in this patient, what you will do? واحد. So it mandates investigation. If you have a red flag in this back pain patient, it's mandate investigation. It doesn't mean diagnosis. It doesn't equal diagnosis. It does mean that this patient needs investigation. The problem that our patient mostly lying about their symptoms. So if you ask him, do you have weakness? Yes. Do you have fever? Yes. Do you have lower limb swelling? Yes. Do you have menstrual period? Yes. And he's a male. So they have yes as an answer for all of your questions because they think if they said yes, that means he will get investigated. So that's why once you have this back pain with a red flag, that's require investigation. So for the next slide, and it's actually my last slide, if you tell me one red flag, you need to tell me the diagnosis you are looking for. And I don't want like everybody jumping an answer. I want show of hand and then, no, not now. So I want show of hand and you'll tell me this red flag is like this and I'm looking for this diagnosis. Okay? So, that's, طيب بنبدأ من ال female. Yeah, start please. Good. So again, مرة ثانية, stable anesthesia and neural retention. This is for coda equina. She chose the easiest one. So any focal neurological deficit from now on it will not be calculated. So any focal neurological deficit for a cord compression. Okay? طيب. Please. Multiple myeloma. So does it multiple myeloma really consider as an emergency diagnosis? Yeah, I will pass it, but it's not really a differential diagnosis. No, you answer one. Yeah, please. Who was here? Yeah, constitutional symptom like? Show of hand, I said. Yes, please. Night sweat or weight loss. Okay. And this side, yes? Fever for? Spinal TB. So spinal infection, I will say. Yeah, okay, sure. Yes? History of trauma, excellent. For? So fracture is an emergency? يعني لو عندك مثلا so I will say if you have a simple fracture في الvertebra, that's mean you will admit all the patient with a simple vertebral fracture. No, خلاص الحين طلع عنده fracture. انت شفت الفراكشر موجود. So any fracture in the spinal cord will require admission. So because you are telling me that this is an emergency, right? So if it's an emergency, he needs to be admitted. So you will tell me fracture with neurological deficit. Excellent. So with the cord compression, nerve impingement. Excellent. ورا كم في واحد? Yes. So any immunocompromised patient for osteomyelitis, so spinal infection again. وش اللي most important من spinal infection؟ أهم واحد فيهم. So epidural abscess. خلاص, that's the mostly commonly missed patient, and those patients they are having a really bad outcome. So epidural abscess and all the infection else like TB, osteomyelitis, all of these will be considered as an emergency also, and meningitis also is one of them. طيب, yeah, please.
Age of patients older than 55, for example. Thinking about termination.
Age more than?
55.
خصم شوي, نزل شوي. 50. So age older than 50 years of age. Okay, any patient older than 50 years of age, mainly because of? You could have herniation and you are 20 years, so it doesn't correlate really with the age. Malignancy is one. Infection is one. في شيء more? So osteomalacia you mean, but this is not really the case in this scenario, the age. في شيء يجي في ال 50 كثير, يجي like a back pain. So we said cancer already, so don't. Huh? Good. Aortic? لا مو aneurysm. Good. So aortic aneurysm. Dissection is usually associated with trauma. So aortic aneurysm. What else? في كمان? Referred where? Not really. Salt? So the same as he said, this is not really a red flag. So most of the patients will have abdominal pain. So we'll go in different territory now. We're talking about abdominal pain that's referring to the back. So or maybe back pain referring to the abdomen. But this will not be an emergency again. So if she had chest pain and you are thinking of? So MI or? Yeah, and dissection. Good. What else? ما اسمع. Substance. So from substance abuse, only one that I care about. So IV drug abuser. IV drug abuser only. If he's taking cocaine or whatever medication, I don't care. Only if he's IV drug abuser he make him at risk of? Not in the back pain, effective endocarditis for sure. صوت واحدة شخص واحد. One only please. Yeah. هنا من النص. Septic arthritis. Why septic arthritis will come in the back pain? Oh, you mean arthritis في الspinal cord? في الvertebrae? No. Yeah. You are telling me differential. I don't want differential. I want a red flag associated with differential. So if he had a history of malignancy, that's a positive point. You know why malignancy is important? This is the only place where malignancy is important as a history. Because if you have a malignancy and now you are coming with a back pain, there is a 20% risk that you have metastasis, which is a really high number for metastasis, for cancer metastasis on those patients. So if this patient have a history of cancer, we consider it serious on those patients. What else? So you cannot ask him about pathological fracture. So you investigated him already. So we mentioned trauma. If you investigated him, that's done. خلاص انتهينا. And I told you, it's not your problem to investigate. No. Fever, قلنا على fever, so for infection mainly. في شيء ثاني؟ طب مين يسمعهم كلهم؟ I want somebody to stand and tell me all of those red flags. So from now on, if you go in any back pain patient, in his bedroom, in his room, and you start asking him, I want you to ask about red flags. Don't tell him, why you came with back pain, this is wallah stupid, why you came here, this is, you are wasting my time. So just ask him about red flag. If he don't have any, he can go home. Okay? So I want somebody to stand up and tell me the red flag. كلهم. إذا جبت خمسة I'll let you sit. يلا. Stand up. Fever.
Old age, more than 50 years.
Okay.
Okay,
Codaquinus diagnosis. I want red flag.
Urinary incontinence, urinary retention, and sudden anesthesia.
So urinary retention, ممتاز.
Neurological defect.
And neurological deficit, focal neurological deficit.
And previous history of tumor or
history of malignancy. ممتاز. خمسة هنا. قبل شوي قاعدين نتكلم الحين لما اشترت خلاص صارت مشكلة. So 5 anybody؟ نرجع مرة ثانية 5 هنا. يلا stand up. خاصة الثلاثة لا توقف تتكلم وانت جالسة طيب. Not history of abdominal aneurysm. This is diagnosis. If you have aneurysm, that's aneurysm. That's diagnosed. IV drug abuser, ممتاز. So mainly weight loss, excellent. TB, immunocompromised, ممتاز. TB is not. History of trauma, ممتاز. باقي واحدة؟ جود. مين اللي قال استيرويد هذا؟ مين اللي قال استيرويد؟ ترى ما ادري، انا ما ادري مين اللي رافع يده، بس انه هذا انا احس انه في المنطقه هناك هنا، بس انه ما ادري مين اللي قال استيرويد. So why steroid is important? So it's a risk factor for fracture and it's the highest between the red flag. If the patient on steroid, he had a 60% chance of abnormality. So if your patient is steroid, it's the highest red flag between them. If the patient on steroid, he had the highest risk to have abnormal finding. So 60% is very high number. So if your patient is steroid, be careful. Chronic steroid we are talking, not the 3 days course we are giving. So chronic steroid user. So mostly it's fracture, it's causing fracture and nerve compression, but most of the time they will have abnormality in the X-ray. It's the highest risk between the red flags. So the cancer comes, the second one, almost the history of malignancy will be the second one of the red flag, where they have almost around 30 to 40% risk of abnormality, I'm talking, in the X-ray and in the CT. Okay? IV drug use is around 20% risk of infection, but otherwise it's actually maybe the third or fourth between the red flag, but the highest one is chronic steroid user. Right. So those are the red flag. have like quick look on this. Actually, we didn't mention. So recent trauma, age of 50, prolonged steroid, osteoporosis, older than 70, syncope. Syncope we didn't mention. Syncope for what? Syncope for what? Dissection. Good. So aortic dissection. You can have the slide, guys. You don't need to photo anything. So diaphoresis, nausea associated with chest pain. Who said acute coronary syndrome? History of cancer, low back pain, worse at night. Unexplained weight loss. Recent bacterial infection we didn't mention also for the same reason. Usually the epidural abscess is preceded by bacterial infection. Upper respiratory, UTI, and those stuff. Intravenous drug use, as we said, immunocompromised status. In the physical exam, you can catch some of those, like focal neurological deficit, fever, loss of sphincter, and pulsatile abdominal mass for aortic aneurysm. That's all.